Well, there actually are a series of trials, and so if you want to talk more about this, the first of them was a study using a drug known as empagliflozin, which is a relatively new class of diabetes drug. That drug was recently awarded a label claim by the FDA for reduction in mortality due to diabetes. It's always a big deal when a drug can be shown to reduce the rates of death. Then subsequently, the Liraglutide study was published. It has not yet been reviewed by the FDA, so we don't have their final word, but I think most of us expect that they will also be given, awarded a label claim for reduction of cardiovascular morbidity and mortality. This is a drug, a GLP-1 agonist that's taken once a day by injection, but that has very profound effects in lowering blood sugar, but it also improves cardiovascular outcomes. These studies and others like them are really beginning to accumulate a body of evidence about what works and what doesn't work at preventing cardiovascular adverse events in patients with diabetes. Well, it's really critical. I mean, the rising tide of diabetes and obesity in America is an epidemic, and that epidemic has as its most important consequences cardiovascular outcomes, which are really quite a severe and common consequence of diabetes. The leading cause of death in diabetics is cardiovascular disease. By some estimates, as much as 60 to 70% of diabetics will die of heart disease. Having drugs now that both help to control the blood sugar, but also control the cardiovascular consequences of diabetes is a very big deal. It's an area we were very much involved in research with going back now more than a decade. We're now seeing the payoff from all that investment in thinking about how to treat diabetes.